Good afternoon, and thank you for joining this session on retirement planning income basics. My name is Dexter Cumberbatch, retirement education specialist here with Voya, and it is my pleasure to have a conversation this afternoon, this evening, about retirement income and ultimately some of the things that you can do to get ready for retirement. As a quick disclosure, I am a registered representative of Voya Financial Partners. Over the course of the presentation, although I'm not able to provide any tax advice or any investment advice, if you have any questions about the topic, please don't hesitate to ask. In fact, I'll ask that you use the Zoom Q&A feature here to submit your questions along the way throughout the presentation. And then at the end, towards the end, I will be more than glad to address any questions. For today's agenda, I'll be touching on modern retirement income basics, how to get started, along with key factors in retirement, identifying and closing income gaps, and then essentially how to get help. Now, over the next, I'll say 45 minutes, my focus is to get you thinking about a plan to manage your retirement income in the early, middle, and even later stages of retirement. Now, while each of you may have different expectations about retirement, your ability to live the lifestyle you want comes down to balancing income and your expenses. Not much different from the way it is and what you're currently doing today. So with that, we'll start the conversation talking about the different sources of income. And you may be counting on different sources of income in retirement. For starters, we all are paying into Social Security. You may even have a pension, which are guaranteed sources of income in retirement. But also you may be counting on some non-guaranteed sources of income. For example, your 401k plan with the ABA Retirement Funds Program, along with maybe you may have other plans. You may also be counting on an IRA or even a rental income from a rental property. Now, when talking about Social Security, which is really important, we're going to start here in the middle. We're going to start our conversation here in the middle. And when I mean the middle of this chart, where you will notice that we started at the age of 67, which for most of us is full retirement age, which is the age in which you can receive 100% of your benefit amount. And now this full retirement age, it is 67 for those of us who would have been born in 1960 or later. Now, in the prior years, then let's say you were born before 1960, for example, the full retirement age is the age of 66. But let's talk about how claiming Social Security before full retirement age or after impacts your benefit. Now, to the left, you see that early retirement, right? You see that early retirement age is 62, for example. And so you are able to collect Social Security as early as 62. But having said that, you'll receive less than 100% of your full retirement age if you claim early. Now your benefit will be reduced. Now, generally speaking, the younger you are and the earlier you begin receiving the benefit, right? Certainly, as I said, the potential benefit is a lot lower. Now, conversely, should you wait past full retirement age? Should you wait past that age for many about 67? You will also notice that the Social Security benefit increases, that the benefit amount, if you delay, increases by about 8% every year you delay Social Security until the max possible amount, which is at the age of 70. So here I want to review again the full retirement age. If you getting to this information for the first time, yes, your full retirement age, if you're born between 1943 and 1954, it is at the age of 66. Now, it is 66 plus 2 months each year after 1954, and then which is going to be the case for many of us if you're born after 1960 or later, that full retirement age is at 67. Now, you're able to get more information about Social Security by visiting the socialsecurity.gov website. Certainly, when you visit the Social Security site, you can get answers to questions like, for example, how much benefit am I going to receive? You can get answers to questions like, okay, when can I apply? Should I wait? And when you get there, when you get to the Social Security website, I would say the first thing is to open an account, right? Is to set up an account online, and from there you can see your Social Security statements and determine the exact benefit amount that you will be entitled to when it is time to begin collecting the Social Security benefit. Now, with that said, I will say that 8 in 10 workers expect that their workplace retirement savings will be a big part of their retirement. In fact, some saying that it will be the majority of their retirement income in retirement. And so the question is, well, are you saving enough? Are you saving enough for retirement in your retirement savings plan? Are you saving enough maybe on your own on an individual basis, so that ultimately you are able to have enough for retirement? And now the data shows, and surveys show that many people they don't believe, they don't feel like they are saving enough. And if that's the case, no worries. I will show ways here in a moment how you can maximize your retirement savings, and essentially how you can boost your retirement savings for retirement. So let's talk about how to get started. And here's where when it's time to get started, and as you begin to plan for your retirement income, you want to ensure that your retirement income can cover your expenses, right, and your needs. And when we talk about needs, we like to break it down into kind of three sections here. Basically, the essential needs in retirement, meaning the housing needs. Certainly, we all need shelter, food, clothing, those basic necessities that we now enjoy and will continue to need in retirement. Also, in retirement, and as you think about your expenses and you envision your retirement, you also want to think about your wants. And this is true for some of the things that you desire and some of the things that you want to be doing in retirement. For example, traveling, maybe along the way as you stay, if you decide to stay in your home, having some home improvements, you may need a vehicle or two during your years of retirement. And then the last category here is your wishes, which is for many of us is our legacy, and perhaps any funding any of our dreams. Maybe checking off some items from that bucket list. Now, one of the best ways to get started as you are planning your retirement income is to essentially create a budget. And when you create a budget, the best way to do it that I have found, and a good place to start, is to organize your budget into using the 50, 30, 20 rule of thumbs. So this helps you think about your budget in three different categories, right? So where you spend 50% of your budget in your needs. Meaning your needs will include your mortgage payments, utility payments, car payments, things like that. Anything you can't do without. Then followed by your wants. So 30% for your wants. So some of those things include, having some fun, maybe certainly budgeting for a vacation and other forms of entertainment, but then and then leaving about 20% for your savings, which is going to include right now your contributions to your employer retirement plan, meaning like an IRA, so some personal savings account, and any accounts that you will fund on a regular basis. So in this model, your budget should again go 50% towards your needs, 30% towards your want, and then 20% towards your savings. But it's also important to remember that this is essentially a guide. The numbers may look a little bit different for every single one of us. Now, as you get started, you also want to once you budget, you want to essentially calculate your monthly expenses, keeping in mind that in retirement, certainly there are going to be some expenses that may go down. For example, expenses like taxes, your mortgage payments, family expenses, household costs, those type of expenses may go down since, for an example, when it comes to taxes, you may no longer be getting a paycheck. So those kind of taxes from your work income may be gone or maybe even be less. And then for other expenses, such as a mortgage expense, you may already be well on your way to paying off your mortgage, or maybe those may be reduced because you simply downsized or relocated and now have less in that cost. And now I want to take the opportunity to also say that and it is a good idea that in retirement you look to try to pay off your mortgage, try to at least get that payoff before you hit retirement. This is so that you can minimize that burden when you retire, especially since you may be living on a fixed income. Now, while some expenses will go down in retirement, you will also have some expenses that may go up. Especially expenses like healthcare, right? We see that as you spend more and more time in retirement, as you spend, in fact, in your later years, you may find that those healthcare expenses are going to be going up as you need more in medical care. You need to receive more medical care and essentially more maintenance. And quite frankly, the data shows that it is estimated that a couple 65 years old will or might spend combined over $600,000 in medical expenses, and this is in today's dollars, and this is what the average couple can expect to pay out of pocket throughout their lifetime. So now, having said that, let's take a look at how you can pay for healthcare in retirement. And I would say one of the ways is Medicare, which Medicare eligibility starts at age 65. But even Medicare coverage is going to cost a little bit of money in retirement, right? In the form of premiums. So I'll get into a little bit more into the different parts of Medicare in a moment, but essentially you have Medicare Part A, Part B, C, and D. But I'll explain a little bit more on what those cover in a moment. And then there's other costs to consider in retirement, where one of them, and maybe a big one, is long-term care. Now, did you know that according to long-term care .gov, seniors ages 65 or older have a nearly 70% chance of requiring long-term care services in the future. Now, when we talk about long-term care, we're talking simply about needing assistance with daily personal activities due to a prolonged physical illness, disability, or even a mental impairment. And because of these odds, it is smart to essentially start thinking about and having a plan and and how you can cover these long-term care costs should the need arise. Now, there are also other expenses to consider in retirement, such as maybe even more travel and entertainment, and also supporting aging parents and even sometimes adult children. One of the ways, and I'll talk a little bit more about that in a moment, in a little bit, where you are able to, if your plan, if your workplace benefit provides it, there is a health savings account, which is a tax-free way. It's going to be a tax-free way to be able to pay for some medical expenses. Now, to take action, because the question is, okay, how should I get started? How can I take action to start getting ready, to start planning? And there are going to be many ways, many things that you can do to take action, and many steps you can take, starting with preparing a written financial plan. This is to ensure that your savings will last a lifetime. This will factor in living expenses, savings and investments, sources of guaranteed income, and your healthcare needs. Now, if you have any questions there, then it is always a good idea to seek professional advice. This is if needed. And now, saving as much as you can. In fact, if you are able to take advantage of catch-up contributions in your retirement savings plan, please remember that when you are after you are 50 years of age or older, you do get to save a little bit more into your employer savings plan by being able to do an additional catch-up contribution once you have exhausted your normal contributions. And then one of the other things that you can do to get ready for retirement, especially if you're getting close, if you're real close, between 10 to 5 years of retirement, you want to make sure that you want to pay off all your debt and avoid taking on new debt. And then in retirement, you may want to consider an encore career. You may be thinking, well, you know what, you may want to work part-time, and if that's the case, you want to factor in that additional income in retirement. And then certainly you want to get savvy about Social Security and Medicare. This is where you can learn more about Social Security and the different claiming strategies that can help you maximize that Social Security, that long-term benefit. And then plan and budget for home modifications. If you've been in your home for a while, especially if you live in your home for over 20 years and you plan to remain in your home, then you will want, and you're going to simply age in place. You may want to factor in the fact that you may at some point have to do some modifications, and then assessing the possibility again of needing long-term care. And this is where you can take some proactive steps by learning about the different options and the different services, and certainly just researching and obtaining long-term care insurance if appropriate for your circumstances. And then one of the important recommendations here is to identify and enlist a trusted loved one. And here's where this may be a little more difficult, but I believe necessary, where you may want to have a frank conversation about your wishes and concerns so that you can build a common understanding about with your loved ones about the potential need for financial or caregiving support. And then with that, you want to also put your financial affairs in order. This means that you may want to establish legal documents as needed. This may include a financial power of attorney or a power of attorney, or even setting up a healthcare or medical proxy, so that or in case you aren't able to make decisions, you can set up these advance directives or even a living will so that your wishes and desires can be respected and followed, and you can have someone that you trust that they will follow your wishes and desires. Now, along the way, you can take action by also using the My Orange Money experience. And you will hear me referring to the My Orange Money experience a few more times during our presentation. This is a way where you can calculate, you can use it to build and to see and receive an estimated monthly income in retirement based on how much income you're saving today. And also you can consider other sources of retirement income. And the My Orange Money experience is front and center in your ABA Retirement Funds Plan website, where again, you can get that estimated monthly income based on all forms of retirement savings, including your pension and including Social Security. So with that, we will now talk about some key factors to consider in retirement. You know, it is hard to predict the future. It is hard sometimes to know what lies ahead. But here are some things to think about in retirement, starting with longevity. You know, we have been living longer and longer. So longevity is going to play a role in retirement along with inflation. And this is where you also want to understand market risk and the sequence of returns on your investments. And then liquidity. Liquidity is another key factor to consider in retirement. And then this is also followed by thinking about taxation and legislation. And then another factor, again, is medical and chronic care. So with that, let me talk about longevity here, where I would say that we have been living longer and longer. You know, with advances in healthcare, we have seen an increase in life expectancy, which means, and in fact, before I say that, I also will mention, and I also say that perhaps this will hit home because we all probably know someone, a loved one, someone that is over the age of 80, whether that's a family member, maybe is a parent, grandparent, or even a public figure. And this means that you may be spending 25 to 35 years in retirement. And the idea is to be comfortable and having enough money, not only the first couple years of retirement, but also, but essentially having enough money all through retirement. And I know, so we know that this living long and living a lot of years in retirement can put a little bit of strain on retirement savings. So the question is always, okay, how can we make our retirement savings last? And in fact, I will say that, okay, so security is going to be one of the few assets that pays a guaranteed income regardless of how long you live. So it's always nice to know that Social Security, they certainly have a cost of living adjustment. Now, when we talk about life expectancy, please bear in mind that average life expectancy is the midpoint. It's certainly not the end point. And this is where, again, you may need to plan on the possibility, on the probability of living about 35 years in retirement, particularly, especially if you're a non-smoker and you are in excellent health. And how you can do that? By investing a portion of your portfolio for growth, which is going to be important to essentially maintain your purchasing power, even in retirement. Next key factor is market risk and the sequence of returns. And here's a simple example of the up and downs of different asset classes relative to one another. And so this table here, it lists the average annual return of multiple asset classes, as you can see the different colors here, from the year 2019 through 2025. And their relative performance is listed from better to worse, or from top to bottom. And keep in mind that here we're not describing a specific investment or any specific investment in your ABA retirement funds program, and there's no guarantee that these asset classes are going to continue to perform this way in the future. But one thing to note here is that when you diversify an appropriate percentage of your savings across different asset classes, then you will see that the winning performers may help to offset the losing performers, which in turn may help to smooth out some of the volatility and make this roller coaster that you see here ride a little bit less volatile. Now, as I mentioned, another key factor here is market risk and the sequence of return. We talked a little bit about market risk in the previous slide, but I also want to say that the sequence of returns is going to be important. When we talk about the sequence of returns, we just want to illustrate the impact of negative returns in the early days or the early years of retirement versus in the later years of retirement. As you can see here from these two different scenarios, all else equal, in both scenarios, the withdrawal rate is at 4%. Is consistent at 4%, along with the average investment return. But you can see that in scenario A, what you find in scenario A is that in the early years, the negative returns are in the early years, versus in the later years, as in scenario B, the losses are in the last 2 years. As you can see, there's a difference in portfolio value. So when it comes down to it, we kind of maybe think that, okay, the average annual rate of return is the biggest factor, but essentially it may not be. It may be the sequence of returns that will have a say in how your account lasts to retirement, or maybe and down the road. Now, another factor is liquidity. One of the key factors is liquidity. Here's where the data shows that nearly 1 in 4 people here in the U.S. adults have no emergency savings at all. And this is according to a bank rate survey. And it is going to be important. It is important right now, even before you're retired in your high income earning years, to essentially have at least 3 to 6 months of monthly expenses. This is no different in retirement, so that you don't have to depend into your retirement income, your retirement savings, that will affect your retirement income overall. So it is always a good idea to again factor in, especially in your budget, a little bit of money aside for emergency savings. And then you also want to consider the effects of taxes, and especially taxes that you will have to incur on your retirement income. Keep in mind that essentially when you withdraw funds from, let's say, your 401k plan or even an IRA, some of those funds may be taxable in the year, or are taxable in the year that they are withdrawn. And up to 85% of Social Security and many pensions benefits may be taxable as well. Now, having said that, we also need to consider that qualified withdrawals from a Roth 401k and a Roth IRA accounts are tax-free. These after-tax contributions made to retirement plans are going to be tax-free in retirement. When you're saving for retirement in your employer plan, keep in mind that it is not an either-or option. You can make pre-tax contributions. You can also do Roth contributions. the nice thing about it is that if you do that, you may get some flexibility down the road when it's time to plan your retirement income, and certainly it gives you some leeway here where you can some of your income may be potentially tax-free in retirement. Now, another consideration in retirement is medical care and chronic care. And let me say is that expenses in retirement are not going to be in a straight line. And we found that your expenses and the way retirees spend money in retirement, it goes a little bit in phases. Starting with phase one here, which we call the on-the-go phase. This is the phase where some people spend more when they first retire than they even did in prior years. And the first couple of years of retirement, those are the years, and that's the time when people have a lot of resources. We have the resources readily available. Many retirees make major expenses, major purchases, maybe a mobile home or maybe an RV. Maybe the plan is to travel extensively, in fact, with family, and even provide significant gifts to family. And this period, this on-the-go period, is then followed by a slowdown phase. This is as retirees age, discretionary spending tends to decline as folks become less active, and then this is followed by the later years in retirement, where again expenses start to come back up, to increase again due to healthcare costs, which is going to make up a much larger portion of the budget in those later years as the focus shifts to maintenance and self-care. So healthcare planning is going to be essentially critical at this stage, and in fact, it's going to be critical in each stage. And some of the ways that you are able to plan for essentially medical expenses is for one, considering a HSA, a health savings account. You want to make sure that you are saving as much as you can for medical expenses, and a great way to do it is through a health savings account, if available. And this is available when you are enrolled in a high deductible health plan. And the HSA, again, it offers triple tax treatment because your contributions are pre-tax, and then while in your HSA, any earnings will grow or may grow tax deferred, and then as long as you use the funds for qualified medical expenses, then you are able to use those funds and make those withdrawals essentially tax-free. So this is a great way to essentially put some money aside for medical expenses in retirement. And then if you are 55 years or older, then you can also take advantage of catch-up contributions into your HSA, right? You can maximize your HSA, and you can certainly save an additional $1,000 to your HSA. Now, many of us are going to be planning on covering our medical expenses through Medicare. And here's a few things to know in Medicare. So if you plan to retire before the age of 65, you have to cover your own insurance until you're eligible for Medicare. So if you plan to retire after age 65, you'll be eligible for Medicare. Be sure to apply for Medicare benefits within 3 months of your 65th birthday, or you just may risk paying more money. Now, it is important to note that Medicare is not free, and it does not cover everything. So Part A, so let's break it down. Part A is hospital insurance, and is included, and so is Part B, which covers most doctor visits and some of patient procedures. But keep in mind that there are requirements. Now, Part D covers prescription drugs. It also requires additional premiums. And there's also Part C, which is Medicare Advantage. This option combines the coverages of Part A and Part B into one plan. And they often include drug coverage too. Or you could choose a Medigap or supplemental plan, which will fill the gaps that come with the original Medicare Part A and Part B. Now, I know I said a mouthful here. Should you have any questions about Medicare, or if you're starting to get closer to that point where you are going to be now using Medicare, please visit medicare.gov, where you can get any of your questions answered about Medicare as you look to begin taking advantage of your Medicare. Now, with that, I want to transition to identifying and closing income gaps. And so when you've added up all of your income sources, you may find that you don't have enough to cover your expenses in retirement. And we call this an income gap. And I'll discuss some ways you may be able to narrow this income gap, or even better yet, even close the income gap, including strategies like maybe saving more in your retirement plan. Now, we know that inflation, even in retirement or even during retirement, is going to be a big concern. It doesn't go away. I think it's safe to say here that we all on this call, we've felt the effects of inflation even today, right? Which is the rising cost of some of the goods and services that we use. And here's where over time you want to essentially manage risk and manage your portfolio, and essentially as you continue to invest, make sure that you have a well-diversified portfolio. When it comes to inflation during retirement, you still want to ensure that you are at least a portion of your investments are invested in growth investments. This is to hedge against inflation. And right now, as you taking a look at your allocation, your investment mix, keep in mind that you may need to rebalance to enhance your risk adjustment returns. So what I'm saying here is that, and in fact, in this example, I'm going to just illustrate where if you would have started with an initial investment mix of 60% stocks and 40% bonds, essentially a 60-40 split. And for the purposes of illustrating this point, this is a 60-40 split, a 60-40 mix in 2003. And this is on a portfolio and an initial investment of $100,000. Well, over that period of time, over the 20 years later, essentially, if you had taken a buy and hold strategy, meaning no changes were made to that investment mix, with rebalancing stocks would have outperformed bonds. And this would have caused the investment mix to drift. So it's now 84% stocks and just 16% bonds. So this won't be necessarily a problem. You would have seen some growth in your investments, right? Which is a good thing. But essentially, you will notice that although you would enjoy that about a 7.89% return on this portfolio, which would have grown to over $40,000, you would have a mix that's riskier than when it started when it was that 60-40 mix. And so here's why, and this is a good reason to meet with your financial professional every year to identify which investments, which asset classes perform to your expectations and retirement objectives. And because, for example, in this example, it would probably make sense to rebalance to the 80-20, that 80-20, or to an 80-20 percentage, or even to that 60-40 that you originally started with 20 years ago. Now, along the way, and over the years, it's always a good idea to essentially take a look at how your risk tolerance changes over time, knowing that the way we feel about investing now won't be necessarily the way we feel about investing 20 years from now. So we want to ensure that our risk tolerance is in line with the stage on which we are at, right? And how close we are to retirement, and essentially how we feel about investing and taking risks currently. And again, this is a good opportunity to review changes with your financial professional. Now, along the way, I did mention that it is going to be, and if you find yourself with an income gap, meaning you figure that your income won't be enough to cover your expenses in retirement, then don't fret. There's going to be a few ways to be able to save to essentially close that gap. One of the ways is to save more. Certainly, you will have the option, and you do have the ability, if you have the ability, to increase your contributions into your retirement account. I will say that professionals, financial experts, do advise or suggest that you work your way up to saving between 10 to 15% of your pay. Now, also, the My Orange Money experience, which you can find on the ABA website, can show you how different contributions rates will affect that gap. Also, one of the ways to close that gap is to lower your expenses, meaning to paying down debts. Interest payments can be a real drag on your income in retirement and your income stream. Now, if you're 10 to 15 years away from retirement, you can and you're able to seriously work on reducing or even eliminating debt by your retirement date. That would be great if you can make some adjustments, some lifestyle adjustments, and essentially get rid of those expenses. That will go a long way to essentially help you and be comfortable and have enough income for you to have enough income in retirement. Also, one of the ways is by postponing retirement. I'll say that it is amazing what a difference it can make in your financial security by simply postponing retirement, maybe 1 or 2 years, maybe pushing retirement into a little bit into the future or a few more years. This will give you the chance of building up more savings before starting those withdrawals in retirement. Now, along the way, I will say, and here's what I'll say overall. Today, the average 65-year-old can expect to live another 11.4 years. And this is the average, of course. And this is where, again, I'll say that please plan to at least spend 20 to 30 years more in retirement. Now, you will find that there are going to be many ways to get assistance. And the good news is that there's plenty of help available. If you, perhaps on one hand, if you want some advice, some guidance, that is available through your ABA Retirement Funds Program, retirement plan, so that you can make the correct decision, which can mean the difference between retiring comfortably and just essentially getting by. Now, there are going to be essentially two ways to get advice in the plan. For starters, you can find online advice on the ABA Retirement Funds website. With online advice, you receive that savings by accessing Edelman Financial Engines. You will get that savings and investment advice tailored to your circumstances. This is by answering some key questions and then using the workflow screen to essentially receive that investment advice. The online advice is designed for folks who essentially want advice, but at the same time, you want to continue to manage your investments, your investment mix. But then there is full professional management, where we can not only provide advice, but also we are able to manage the investments for you. So this is available through Voya Retirement Advisors. And again, if you are comfortable or feel confident making investment decisions, then you may want to consider online advice. But if you need help and getting on track and then staying on track, and certainly you don't have time to research investments and keep up with your account, then you can hire a team of professionals to manage the investment accounts for you. In addition to monitoring your retirement account and investments, it's also important to engage in what I like to call a holistic retirement planning. And here's where you can partner with a Voya financial advisor. Together with a financial advisor, you can create, you can explore, you can chart, and then act on a financial plan. You can certainly discuss your vision and goals for retirement, and from there start pulling your financial picture together, and then develop a plan, and then begin to develop a plan to achieve your goals. The advisor will be showing you different scenarios based on different goals and income options in an effort to improve your outcomes. And then after it's said and done, regular reviews with your advisor, this is at least annually, will keep you on track and essentially identify any events or any changes that may affect your retirement income goals. Now, there are going to be a couple ways to receive that financial plan. One way is a retirement snapshot, which is designed for those who with a relatively simple financial situation who want to get answers to questions like, am I on track? If you want a plan, you're thinking, am I on track for my retirement goals? How much income will my savings essentially generate for me each month when I retire, or even how long will my money last? Then certainly you can meet one-on-one with a Voya financial professional who will analyze your situation and from there provide answers. But then there is the ability to get a financial plan. And this financial plan is a fee-based service designed for folks who with more complex financial situation. It addresses strategies for various financial goals, maybe including your retirement income, if you're thinking about estate planning, life insurance, and then from there, the advisor will help you prioritize actions to reach your goals. Now, to schedule an appointment, you may, I'll say, scan this QR code. It takes you directly to that screen so that you can essentially book an appointment. But you can also call. You can also call Voya Financial Advisors at this 844 number on my screen for a complimentary one-on-one session with an advisor. Now, there are going to be other ways to essentially manage and access your ABA Retirement Funds Program 401k account. Certainly, we do have the abaretirement.com plan website, but there's also the option to download the Voya app the Voya mobile app, where you can manage your retirement plan on the go. And if you prefer to speak with a live person, then you can essentially call the contact center between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday. And with this, it looks like there aren't any further questions. Thank you again. Thank you, everyone, for joining this presentation. Have a great rest of your week. This will be the end of our presentation. Thank you.